All right, good afternoon. How many of you guys watched the movie Up? Good afternoon. My name is Russell. Seriously, my name is Sarah. I'm the Deputy Director of the Arizona Multi-Housing Association. I'm excited to be here with you today, and on behalf of the NAA, I'd like to welcome you to Workplace Mental Wellbeing, Why and How to Support Your Team. Before we get started, I've just got a few announcements and housekeeping remarks for you. This is an important topic, and we would appreciate if you could turn your phones on silent or off. Also, if you haven't downloaded the Apartmentalize app yet, go ahead and get that done, because you can access the conference materials and then also tell the speakers how wonderful they did today, because we know they're going to kill it. If you have your NAAEI credentials, you will receive 8 CEC credits for this conference, and your credits will be automatically applied to your account. Now, here's the tough part. I'm going to introduce these folks, and I've practiced all night. So help me in welcoming Tremaine Elamine, John Sons, and Jean Supin.
That was great, by the way. Practice pays off. So welcome. How many were with us this morning in our first session? Welcome back. That teaser worked to bring you back, right? So we're going to reveal just a little bit. We're going to recap, I should say, just a little bit of what we covered this morning. But we're going to get in some new information. And I know this is the last session of the day, but you're not going to want to miss any of this. It's going to be a fun and informative session about mental health. But I want to get started talking about the NAA Mental Health Subcommittee. I want to do a quick review for those of you that weren't with us this morning. When we created the Mental Health Subcommittee, we wanted to target 3 main objectives. First of all, I should say we wanted to determine who our audience was. And our audience was everybody, right? We all have mental health. Every human being on the planet has some level of mental health, right? Not everybody has high blood pressure, not everybody has high cholesterol, but everybody has mental health. So the audience was everybody. But we wanted to focus on 3 things, and that was making the conversation easier, and you should all applaud yourselves for being here today, because you're part of making that conversation easier. So go ahead and give yourselves a round of applause for being here today. We appreciate you being here, because you are part of that movement in making that conversation more comfortable. We also wanted to focus on how the mental health of the on-site team members and the residents, they coincide, they coexist, right? They butt heads, they are involved with each other, so we wanted to target that, and we wanted to target the effects of trauma. Some accomplishments that we've already had, well, these 2 ladies up here are part of one of the accomplishments, and that's our relationship with the National Council on Mental Wellbeing. We could not be more thrilled that NAA finally has a relationship with an organization such as theirs. And we've completed 2 mental health surveys, which we talked about this morning. We talked about some of those results. We also had our first ever NAA Mental Health Awareness Week. That was in May. Did anybody get to catch that? Hopefully you were able to catch. I see some hands going up in the room. That was the first ever Mental Health Awareness Week that we had in May. And we're now offering mental health resources to NAA members, and we're going to be offering some training, some mental health first aid training, and some mental health first aid trainer training. That's a tongue twister, but I think I got it out. Did that sound right? And so basically, NAA is going to have their first ever mental health trainers, and we're just super excited about that. So talking about the survey, one of the things that we revealed this morning is 67% of our respondents had taken time off work because of mental health, either for themselves or for a friend and family member. 15% of those folks had taken a week or more off, or you should probably be surprised by those numbers. It's actually a surprise, but not a surprise. And we were speaking before this session started today. The good news about that is, if there's good news about that high number, is people realized that they needed to take time off for their mental well-being. So that is a silver lining in that percentage. We learned in the survey that communication is key. If you look through the text responses of that survey, and I've not read all 3,600 and some odd text responses, but at a quick glance, if you just go down, you see communication, and you also see upper level management understanding. Our employees want to know that our C-suite level employees, our regionals, our executive teams that are concerned about the mental well-being of their employees. Folks are stressed about their workload. The good news is, overall, folks are slightly less stressed than they were in 2021. When we did the 2021 survey, though, people were more stressed in 2021, and we did that survey in September and October of 2021. People said they were more stressed in 2021 than they were that same time in 2020. Which, if you think about what we were going through in September and October of 2020, weren't we all pretty stressed? So the good news is things are getting better. And people want to know, is there support being offered by their company? They want that support to be offered by their company. They want the conversation to be comfortable. And some people didn't know that their companies even offered support. The companies did offer the support, but they didn't know about it, or they weren't comfortable asking for that help. And going back to some of our other medical conditions, just think of any medical condition. You're not afraid to go to your employer and say, I need to go have this test done or go to this doctor's appointment, but people don't feel safe saying, I need a mental break. All right, so I'm going to turn things over to Jean. Jean, we're thrilled that you're here, and I'm going to let you take over.
Oh, thank you, John.
Absolutely.
Thanks for having me. Thanks to all of you who are here at the very end of the day. I'm Jean Symptom. I am with the National Council for Mental Wellbeing. Should I do something else?
I think I jinxed us
He
because
told me not to use the handheld, and you have proven to be correct. So I'm delighted to be here. I'll just yell until he arrives. The National Apartment Association reached out to us over a year ago. Thank you. A blind query, and it has been a fabulous partnership ever since. The National Council for Mental Wellbeing is a trade association similar to the NAA. We represent about 3,500 mental health and substance use provider agencies around the country. These are folks who provide, a whole array of services to folks in your communities, probably to your residents as well. And similar to any trade association, we do lobbying on Capitol Hill and in state legislatures, and we offer training and education to our members, and we do lots and lots and lots of member services. Again, agencies that provide mental health and substance use services. And then we also do a lot of work with organizations that have nothing to do with mental health and substance use, because, as John said, all of us have mental health, and many of us, or family members, or loved ones, or community members that we know struggle with mental health and substance use challenges. So again, a little over a year ago, NAA reached out to us and said, we know our folks need stuff, and we don't exactly know what, and we want to partner with somebody in the country who's sort of an expert in this field. And it's been a glorious partnership. Your leadership at NAA has been incredible to work with. And they've been saying, we want a long-term relationship. We want to better understand what our membership needs and begin to offer whatever they need, offer services, offer training, offer opportunities over multiple years, many years, hopefully an unlimited number of years. So I'm just here to introduce you a little bit to the National Council for Mental Wellbeing, and I'm not going to take up any more time because our primary person here is a dear friend and colleague of mine, Tremaine Elamine, who is an expert in a variety of things, including a particular training we offer, mental health first aid, and mental health first aid at work, which, as the name suggests, are trainings designed for folks who don't know anything about mental health and substance use, but would like to be able to be supportive and helpful if someone standing next to them is suddenly, sort of suffering. We're not asking you to suddenly become a therapist. We're not asking you to fix anything. We're just offering some ways that perhaps you can ease in the moment and help someone in the moment find what they need. So, with no further ado, Tremaine.
Thank you, Jean. Hey, y'all. Yes, let's give Jean and John a hand clap there. I'm excited, if you can't tell. I dress like I'm excited. I'm excited because I get to go around the country and tell people what to do. It's my favorite thing ever. I get to go around the country and tell people to care about each other. Tell people to slow down and take care of themselves. Tell people that they need to pay attention to their surroundings. I say that having bumped into somebody while walking and texting at the same time. And a lot of the times we do that. We take our work really seriously because we care about it. We take our lives really seriously, but sometimes we don't necessarily give that care and concern that we give to others back to ourselves. And so I want to start there and saying thank you. I've lived in apartments my entire life. Ownership is overrated. And I know what it takes because my mother happened to be a property manager on site. Where are my on-site folks in the room? All right. Earlier in the session, someone said, give a hug to your regionals, right? Can y'all just wrap your arms around the on-site folks? The things that you all are dealing with, the things that you've seen, the things you hear about, some of the challenges that exist in addition to the regionals, in addition to the entire industry, there's a need. The wonderful thing about the need is that it's not necessarily an isolated experience. It's something that we are experiencing together. And I want to give you a few pieces of the puzzle that others are experiencing around the world and in our country, but also this is about a dialogue. I said, hey, y'all, because this is a conversation. This is about us talking to each other and then talking about not only what we need to know, but then what do we need to do? What are those actions we can take? And really, it's literally in the palm of your hand, provided you have a smartphone. It is something that we all can do. We're going to do that before the end of the time. Are you with me? Okay, listen, I grew up Baptist. All right, are you with me? Okay, let's keep it moving. So what do we know? We know that outside is a mess, y'all. Outside, 1 in 5 of us are going to meet the criteria of a diagnosable mental health condition in any given year, right? For substance use, there's a dual stigma associated with substance use challenges, and almost 8% of individuals will meet that criteria for a substance use challenge. That trends up or down depending on where you are in the country, but what we know is that those unmet needs, there's going to be impacts at work. We spend the vast majority of our time in the workplace. And so what we know also is it's going to be really important for us to pay attention to that because of lost time at work, presenteeism, absenteeism, and it's hitting the bottom line. If we can't tug on the heartstrings, we definitely can point out those purse strings impacts, right? And so it's really important for us to recognize what we know is that things are not working well. But they also need to know is that hope is available and help is available and recovery is an option. I want to plant the seed of hope and we'll talk a little bit more about that hopeful thing, but you all are having conversations. You know exactly what people say when it comes to mental health or mental illness or addiction. So, as I mentioned, I grew up Baptist. You're going to talk to your neighbor. And we're going to talk to our neighbors because we're in community together. Community is one of my favorite words. And so when people in the industry hear the word mental illness or addiction, what are the first words that come to mind? You got 1 minute to win it. Talk to your neighbor. What are those first words that come to mind? 1 minute. I'm counting. Let's go. I don't hear chatter.
We don't hear chatter. Come on, chatter.
Talk amongst yourselves. All right, wrapping those conversations up in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. All right. You got some words, you got some buzz going. I see people are, having great conversation. What were some of those words? Let's throw them out. Problem. Stigma. Drama. Crazy. I was looking for that. Well, thank you over there. I was looking. Oh, she's telling. I love how she said it over here. Yes. All of these things, right? How many of those words were positive? 0, right? None of them were positive. And yet, we expect people to disclose their own well-being status to us when we talk like that every day. It got real quiet. You hear that? Right?
Just like at church, it got quiet.
It got quiet, right? And so that's what we're here to do. We're here to demystify mental illness, demystify addiction, destigmatize these words, because it's important how we have conversation about mental health every day, because then that determines what our residents think, what our colleagues think about disclosing that they are struggling or someone in their family is struggling, right? It's important for us to do that. So as we think about mental health awareness, it's not just about feeling good and, being politically correct. It's about creating and fostering an environment where we can reduce stigma, we promote literacy, and then what that does is it decreases social distance. Now, you heard social distance a lot in the last 2 years. Nobody knew about it before then. We were using it to talk about, measure, and understand what it means to decrease stigma. Measurement of stigma is not easy. Measurement of the reduction in stigma is not easy, but it's possible because it's some really techie and data people that are not me who have figured that out, right? And what it means is that we're decreasing the distance between someone being willing to be in proximity to someone else who might be struggling. And so that also increases the likelihood that we're going to do something and not just talk about something. It teaches us how to connect. Teaches us community, right? And so what does that mean? Well, Jean talked to you about the National Council for Mental Wellbeing. It's all good to have conversation, but then what's the action we take? Well, we need to advocate for things that make sense to transform our mental health system. This week, we got some news that there's been a huge influx of funding to support some of that. And yet our systems are challenged, right? There's an opportunity there to increase access, to make sure that people can have access to resources, not only in their workplaces, but in their communities as well. What we do is we advocate on the Hill for change. We make sure that people know what's the best practices in the community and in treatment to make that happen in ways that make sense and resonates with individuals. And then the other thing that we do is make sure that we represent those members well by giving them new tools, giving them ways to learn from each other around the country, much like you all learn from each other when you come to meetings like this. Now, I will say, I was very impressed with National Council 10 years ago when I joined the team because they had this awesome conference. Guess how many people were there, y'all? I didn't hear any guesses. 3,000. Yeah, wasn't that a lot of people in my mind? Then I came here. Y'all had like 14,000 people here, right? But we all have the same shared experience and journey of making sure that we're making an impact. And you see some of the ways we made those impacts over the years. We've been around for about 50 years, but our flagship program is Mental Health First Aid. Now, how many in the room have taken CPR First Aid? Get those hands up. Look at all these folks, because why did you take it? It's a requirement. Bingo, bazinga. That is why, right? How many people a year do you think people get certified in CPR First Aid? Millions, right? Millions. More than 12 million. It was 12 million a few years ago. I think it's more than that now. How many people do you think we've trained in mental health first aid? 10,000? Come on, y'all. We're a little bit better than that. Come on. 100,000. We've trained almost 3 million people to recognize the signs and symptoms, and 4 million people globally. It's in 25 countries. It's an evidence-based program. And I liked it when I was not working at National Council. I became an instructor in my community to make an impact in my community. And I think that's the beauty of it. While it's a national program and a global program, it really is about the individuals. And so I'm so grateful that the National Apartment Association is not only investing in a training program, but they're investing in a shift in culture. Because that's what we see happen. When people take this on and take on addressing mental health in real and tangible ways, not creating therapists, because listen, you're not going to leave here and say, well, Tremaine said I can buy a nice couch, rent some space, and charge billable hours to give out my advice, right? That's not what we're doing. We're giving a 3-year certification, just like CPR or first aid, that says you have met the requirements to know where to tell someone to go to get help. That's it. And what that means is we're doing that for adults. We're doing that for adults that work with young people, especially in light of all the things that are happening in this country as it relates to our youth. Then we have a program for teens that is specifically for them in 10th, 11th, and 12th grade to support each other, but also, and what we're going to talk about today, is mental health first aid at work. And it's about the workplace. It's making sure that we talk about the workplace. So, again, we're in community. I want you to talk for a minute. What is the one thing at work that someone said or wish they said at work that made you feel supported? 1 minute. Talk to your neighbor about one thing that someone said or you wish they said at work that made you feel supported. I'm not hearing chatter. Come on.
This is great. It's a great way to close the day. Give her that mic when you're finished so she can drop it. This is what
All right, let's wrap it up in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Anybody want to volunteer or somebody voluntold someone else to tell me one thing they heard? One thing. What's one thing that somebody said? I can't imagine what you're going through. And I love that because it's not, oh, I know exactly what you're going through, right? Very different. What else? I validate you. Amazing. I understand what you said. I appreciate you. Y'all have some good coworkers. This is awesome. One of the things that we do is we teach people a 5-step opportunity to understand how to do it. Now, in first aid, you learn the ABCs of CPR, right? And now, if you've taken it recently, it's CBA, right? It's in a different order. This is algae. Sounds like pond scum. It's a cute and cuddly koala because the program came from Australia and was created 20 years ago. So, what does that mean? It means we're assessing all the time. We're looking to see how we can help that person, but then we're figuring out how to approach. We may not be the right person. This may not be the right time for us to try and talk to someone about what they might be challenged with. We want to listen non-judgmentally. Now, I thought I was a good listener, then I got married about 7 years ago. I can use some work. But listening non-judgmentally means listening and then suspending your judgment. Doesn't mean you won't have them. We judge all day, every day. We have biases. They exist, right? So how do we try to suspend some of that and hear where a person is coming from? We give reassurance and information and not advice, right? That's different from advice, and we talk about how that's different. Then we encourage help in 2 ways, either professional help or self-help and other support strategies. And when it says appropriate professional help, sometimes it's not just a therapist or a clinician. Sometimes professional help could be something else, right? Sometimes that help might look different depending on a person's circumstance, their identity, their experience. We want to recommend things that will resonate with that person, and we teach how to do that. And what we're going to do for the rest of the time is actually apply some of that. One of the things that I want to really focus on is the fact that this is not all about gloom and doom. This is not all about what's wrong. There are certain risk factors that mean we might experience challenges in greater ways as a result of being in the industry. And then there's other protective factors that help us out and make our well-being a little bit better. So as you look at this list, think about it. Rising stress and violence, the residents that we are engaging with, how fast-paced and competitive, that sets us at increased risk for mental health challenges. And when we define mental health challenges, it's not just illness. As John mentioned, we are all on that spectrum of having mental health, but our mental health is impacted by these risk factors, which could put us in a position where we might have even more challenge and meet a criteria that's different than our day-to-day stress, right? In addition, there's protective factors, which the fact that there's demand for people to have somewhere in place to live, that there's opportunities at all the skill levels across the industry, that there's social interaction. Y'all are like the social butterflies of all of the workforces, right? Collaboration, all of those things. And that those opportunities to say, this is my boundary, y'all are good at that. However, when the protective factors are outweighed by all the risk, and then the stress of the environment happen, there's when we might see some signs and symptoms. Now, signs are things we might see, symptoms are things we might feel. What are some signs that you think in the workplace we might see if someone is really struggling with mental health challenges? I heard something over here. Say it one more time. Seclusion, yes, isolation and being secluded, absolutely. Missing deadlines, attendance issues. Yes, absolutely. Focus, appearance, yeah. You all can, why don't you just come up here and do the rest of the presentation? Come on. No? Okay. It was good. It was a good list. All right, let's see what the survey says. So, changes in self-care and appearance, you got that one. Emergent lateness, right? Attendance and presenteeism or absenteeism. Withdrawing from coworkers, got that one. Increasing sadness or mood changes. Yeah, absolutely. What about symptoms? What might someone feel? Sad, depressed, right? Tired, worried, lack of connection to work or career. People got in this for the right reasons and now they're just done, right? That survey that was shared by my colleagues earlier, and Jen was talking about in that survey, 25% of folks at the regional level want to get out now, right? And so that's going to be really impactful. Difficulty concentrating or focusing, and hopelessness or despair. The one that we want to pay attention to is that last one, definitely. Because when people say things like, I just am so tired, I can't do this anymore, we don't know if that's thinking about or contemplating suicide unless we ask directly, and we're going to talk about why that's important. So how might these signs and symptoms look different in different areas with residents or vendors, right? They might be a little bit different. I would venture to say that signs and symptoms look different also in a remote work environment than they do in person, right? I didn't know that John had legs until I met him here at the conference, right? I didn't know what the rest of his body looked like because I saw the little square virtually. So we need to pay attention to that 2x2 box, I guess it would be, to understand what sign or symptom are we noticing in our coworkers, in our residents even, if that's an option if you're on site. How does that look? What about our vendors? You all have great relationships with your vendors in a lot of cases, maybe some not so much in others, but mostly good relationships. You see the same folks all the time. You come to Apartmentalize and you like high five each other because you've seen each other and industry colleagues. What are you noticing? How do we notice the changes? How do we pay attention and make sure that we're noticing enough to do something about it? So when we think about that, one of the things I think is important to do is think about the fact that you are at the center of this. Self-care is important. Across the way, there's this well-being kind of corner over here, and there's yoga and all kinds of other mind-body exercise kinds of things that are happening along with meditation. Those are self-care, but self-care has become this hashtag, y'all, that I'm kind of like done with. I don't know about you, right? It's like this trending topic of bubble baths and trips and all that. And this is good, that's great. All right, for those that it works for. Self-care might be, I really am going to give myself a boundary at least this Wednesday. Can't do it every day, but I'm going to turn my phone off at 5 o'clock. and whatever will be, right? It might not be every day, but I have to do it at some point. Self-care is knowing what is it that points out that my batteries need to be recharged. For me, I get hangry. Give me a Snickers, right? For others, it may be unplugging and unplugging from social media, right? It just depends on the person. And it may be more complex, and it depends on what resources you have to conduct that self-care. Sometimes it doesn't have to cost anything for you to create a boundary, right? So thinking about supporting ourselves, that's part and parcel of what we do, because we can't really support someone. Now, what I will say, you've heard that phrase, don't pour from an empty cup. The problem is we still do it, and we wind up in a deficit. And then when we're in that place that's a deficit, it's really hard to get back. I don't know if anybody's ever been dehydrated and drinking water didn't do it, right? It doesn't do it automatically. You got to get something else in there. That's the same thing when it comes to us pouring ourselves out to support others. There's also a disconnect in not only this industry, but all of our industries globally. 96% of CEOs believe that their companies are doing enough, where 69% of employees kind of agree with that, right? This was some research that was conducted. I would venture to say industry to industry, there's even more of a divide about what folks might think they're doing to support their teams and what is actually being experienced, right? I also loved, in the session earlier today, there was a comment around the fact that people who are working in a corporate space may have amenities and supports and things that are really supportive in this industry, but don't have it at the site level, those same kinds of things, right? But they're ones that are dealing with the day-to-day stress, right? And so how do we bring that equity and inclusion there? That's part of this divide. That's part of what's showing up in these statistics. And so I think it's important to realize that supporting our workforce means that we know and realize that everybody processes stress differently. I might be laughing and joking with you and be stressed the heck out, right? I might come in on time every day, but that does not mean I'm okay as a good worker. It just means that I'm meeting my deliverables and barely making it outside of work, right? And so making sure that we know we process stress differently, encouraging people to reach out to those EAP services. Listen, first time I used those, did not know that it even existed. I know most folks, when's the first time and the last time we look at our EAP number? Orientation, right? That's the last time we pay attention to it. So it's really important to pay attention to that. The other thing I think that's important that I want to, as you look at this list, I think there's another piece that we've learned collectively over the last couple of years. We need space and time to really process things in a different way. And there's not always that available, don't get me wrong, but taking that time out, I don't care if it's 5 seconds at the beginning of a meeting, which I'm sure you all do, but really doing that genuinely. Okay, I'm gonna test this out, because you think I'm playing. All right, let's say it's Monday morning, right? Monday morning, I'm coming into work, I say, good morning, y'all, and what do you say back?
Morning. And
it's the weekend, right? It's Monday morning. And then the next thing you say was, and what is my response? Good, amazing, wonderful, fine, right? Now, if you are really doing inclusion, if you're really doing addressing mental health, and if you really have an environment and a culture that supports people, you're gonna dig a little deeper. So we're gonna try it again. Go over here. All right. Do not run in heels on the stage. So I'm coming in on Monday. I come in the door. Good morning, y'all. And it's Monday. Well, you know what? I actually wasn't feeling too well, so I went to the hospital and I was a little depressed. So what happened is, I talked to my doctor. They sent me in, and I was on a 72-hour hold, but I feel way better right now. And I'm glad to be here. I do feel better. I'm still trying to work things out, but I'm going to my therapist, and I think I'll be okay. Can you come work with me? Can you come work with me? Did you hear that response? Is there any way that I can help? Because if I said that I got COVID, or if I said that I was sick and I wound up being hospitalized, I would get flowers and not strange looks and maybe some food and a meal and some kind of support, right? But until we can get it, and we're not going to get there tomorrow, don't get me wrong. I used an extreme example just to point out the fact that how do we really treat people when they're returning and from what we might know or may not know is a mental health challenge, right? How do we support and create an environment where it's okay not to be okay and not just put it on a t-shirt, right? It takes work, but there's some things we can do. Can we start? We can start with how we treat our residents. We can start with how we support ourselves. And we can start with saying some things a little bit differently. Now, you've seen kind of on the internet, interwebs, stuff that looks like this, right? These are some phrases you probably want to say. These are some things you might want to stay away from. And it really depends on the person. But asking, are you okay, is a great place to start. Are you thinking about suicide? Notice that that is really direct. And actual evidence demonstrates that that is the way to do it. You actually can address it directly. To say things like, are you hurting yourself? Not as helpful because it can be ambiguous, right? It really is about saying it directly. But I would only do it if you're comfortable, right? You don't want to seem nervous in front of someone, and you want to tap somebody else who might have a little bit more training or a little bit more support and feel more comfortable having that conversation if you're uncomfortable. That's okay. We're going to talk about how to do that. The other thing is, think about that not that list, right? Have you ever, okay, how many of us in the history of calming down have ever calmed down when someone said, just calm down? Right? Probably not. So there's certain things that are not going to be helpful or fruitful to a conversation that we want to avoid, and you see them there. I think also when we think about residents, we want to be aware of these things, and these came from the National Apartment Association in 2020, some best practices around supporting residents. The legal considerations, crisis planning, really understanding what it means around mental health and trauma and how that impacts individuals. The other thing is knowing what's in your backyard and knowing if those phone numbers work, right? It's not just about having a number. Does somebody pick up on the other end? In about less than a month, we're going to transform this number that you see here, the National Suicide Prevention Helpline, Lifeline number, is a longer number, right? It's 800-273-TALK. Remember when I said the power's in the palm of your hand? Go ahead, take out those smartphones that they told you to silence. And I would love if you program this lifeline in to your phone, because you can help somebody in a crisis just by having that number. You can take a picture of it, you can plug it into your phone, but just that number is enough to support someone who might be struggling, because you don't have to have the answers. On the other side of that conversation can be someone who is trained to support the person to respond. Now that number will change to 988. What I will say is it's a process. I don't know if you remember, I wasn't around, but I don't know if anybody was around when 911 was like launched, right? It was a process to get there to where it was standing up and ready to deal with the influx of calls. Same thing is going to happen with 988. We're advocating, trying to get legislation, trying to move things along. It's going to be a journey, and they're looking for volunteers. So if you want to volunteer on the Lifeline, sign up. But definitely, it's important for us to have that as a resource, and you can put that in your phone. Before we get into this last piece, and before we kind of do some practical application of ALGEE, remember I taught you ALGEE earlier, ALGEE, right? You memorized it? Yes? Yeah? You memorized it? No? No worries. No pop quizzes, but I want to make sure that you give us your feedback about how you think the session went, and let us know how we can improve it. Always looking to hear how you have perceived your experience today. So I want to put that reminder in there. And what we're going to do now is read a scenario, and we're going to do ALGEE together. You'll get to experience what it's like to apply that ALGEE action plan to a scenario. Sound good? Are you still with me? I know it's after lunch, and I'm keeping you from dinner. This is a great time slot. Yes? Yes? Okay. All right. So one of the things that I also want to point out is as we do this practical application in this scenario, there's two pieces of mental health first aid at work that are different from our community program. In our community program, we've trained, like I said, almost 3 million people, 2.7 million people and counting, and we also have 25,000 instructors across the country. Our workplace program, we deliver to employers. We have folks like Delta and Starbucks and folks that we come to them to support it, but we put two things around it, the cultural context of the organization as well as the workplace policies and procedures, because those come first. We're not replacing any policies and procedures. We are just saying, here's another tool that you can use. So what signs and symptoms you noticed are the one thing you're going to look for in this story that I read to you. And then the algae steps that should be demonstrated. Okay? You with me? All right. You've known your colleague for about 2 years. You sometimes grab a coffee together, and over the past 2 years, you've talked openly about your personal and professional lives, virtually, and on the road at site visits. In the past month, you've noticed your colleague is withdrawn, less animated, and very pessimistic. Your colleague just disclosed the long-term relationship ended, they were turned down for a promotion, and after covering for a regional manager out on leave, it's been very, very difficult. You watch them struggle to control emotion. How do you apply algae? So what would we assess? What's going on with the person? Throw it out there. What's going on with the person? A lot, right? Great. Great assessment. Listening non-judgmentally. How do we listen non-judgmentally? What is the response that you have visually? What are your facial expressions? What is the nonverbal response? Because some of us might say, oh, please, been there, done that, got a t-shirt, it's no big deal, right? Others of us might have a different response. Then what advice would you give? Somebody throw something out. Trick question, don't give advice, right? We want to give reassurance. I see that that's really distressing for you. Really, I understand that this has happened, and you are not alone in this, right? That's reassurance and information. Again, we want to encourage help. Do you think this warrants professional help right now, based on the information you got? Probably not, but it could be encouraged, right? And you might want to encourage self-help or other support strategies. So hopefully this gives you a good place to start. And what I'd love for you to do is think about a couple self-care activities you can do for yourself, whatever floats your boat. It might be a root beer float. It might be something that you do for yourself. You could do that in the next 7 days. 2 people you can call when you're hangry, like me, or you know your tank is empty. And then 1 goal you can do in your organization as it relates to making sure you can work towards it in the next 3 months. I hope you have gotten something out of me rambling for the last 20 minutes at you. And I'm looking forward to John telling us what we can do next.
Yes, thank you. How great was that? Huh? She deserves better than that. Come on. There you go. So for those of you in the room that know me and know how excited I've been about this new partnership with the National Council for Mental Wellbeing, do you understand why I'm excited now? Yes. Huh? And hopefully it's gotten you all excited. So we're going to go through this real quick. We've got some future focuses that the Mental Health Subcommittee are going to take into consideration are continuing to bring awareness, making the conversation comfortable. Was the conversation today at all uncomfortable? Huh? One thing I didn't tell y'all when we started today, but I started this morning, I told you this morning, and I'm going to tell you now, I am a mental health patient. I have had some really bad struggles in my life. I am not afraid to tell y'all I am an active mental health patient. I am. So chances are you know somebody that is or could be, and don't let that person be afraid to talk to you. And if you're that person that needs some help, don't be afraid to get help. It's okay to not be okay, and it's okay to be there for those people that need help. We're going to provide training on the executive level. I got to tell you, the board of directors have been really engaged. Our next steps are going to be working on C-suite training, hopefully with our board of directors here. I know they're excited. They've been surprised by some of the things that we've shared this week. We're going to be seeking volunteers for some violent testing on the mental health first aid training that we're going to do. NAA is going to pay for 20 people to take mental health first aid training. We're going to be accepting applications online. Be looking for more on the NAA website about that. And NAA is also accepting applications. I'm just super excited about this. We are going to have 5 NAA mental health first aid train the trainers. We're going to have our own trainers in NAA. We're taking applications for those. We've got 5 spots. Don't get mad at me that I took 1, so we're looking for 4 more applications, all right? And then we're going to continue to grow our resources. And we've had affiliates reach out to us about how to develop their own mental health subcommittees. We're all ears about those requests, and we're going to be actively involved, along with the National Council of Mental Wellbeing, on helping you set up those mental health subcommittees in local affiliates. So what do you think about that? That's some pretty good news, right? And we're going to be focusing not only on our owners and managers, but our supplier partners are an important part of the process. And we're going to be seeking volunteers for the 2023 Mental Health Subcommittee. Anybody that was on the 2020, I've been fortunate enough to chair the committee the last 2 years. Do we have any subcommittee members with us today? Could you stand up? We've got one. She's a trooper, and listen, they're hardworking. And James is here. He's been helping us as well. James's contact information for more information about what I've discussed today is up on the screen. I'm going to back up so you have that real quickly. I've got some of these handouts up here with a QR code. You can scan this QR code and it will give you the results of the mental health survey. So feel free to come up and get some of these, scan these. If you want to scan it and leave some behind for other participants, please do so. With that, we're finished. Don't forget to go and fill out the survey. We want to know what you thought about today's session, and thank you for hanging in here with us today. Thanks so much.